Hello everyone, it is 12:30, so we are going to go ahead and get started. If you're listening to us live, remember that there's no video component to this. You should not have had a video box pop up on your screen, but in case you did, just X out of it. Remember that all the phones are muted until the very end, where we will unmute them for phones. I'll talk about how you can ask questions here in just a second. This event does qualify for 0.5 hours of Category 1 AMA PRA credit, whether you're listening live or you're listening to this as a recording. If you want to claim that credit, you have to fill out a survey. So for the live attendees, that survey is in your calendar appointment. For those of you listening to this as a recording, the survey is under the additional notes part of the YouTube video. So for questions, if you look on your participant list or you hit the chat button that's at the top right side of your screen, you'll see a list of the participants, and if you find Alex, you can chat with me on the side. I'm monitoring from a different computer, so if you have a question during the presentation that you want to ask so you don't forget, go ahead and send it to me. If not, wait until the end and we can unmute the phones for a conversation and for questions. This is my contact information. Should you have an idea for webcasts or educational material you'd like to see in the future, you can email me here, outreach@carillionclinic.org. That comes right to us, and this is our office number, 981-8231. Just a quick kind of shameless plug here for the different educational sessions that we do. Obviously, you're listening to this as a lunch and learn session, so we try to tackle bite-sized topics. So we have less than 30 minutes to go through this material, so we really try to focus in on one specific thing. For the last 9 months, we've been hitting a lot of our community outreach programs and bringing different community organizations in to talk about their programs. Today's no different. We also do weekly Pediatric Grand Rounds webcasts, so if you're not on our list and you'd like to be, email me again and I'll get you on the list. You can watch all of our recordings on our YouTube channel. We recently moved over to our own, so we were on the Carilion Clinic YouTube channel. We had a playlist. Now we have our own channel, just Carilion Children's Outreach Education, and you'll see our channel there. If you're wondering, all of our digital education is free of charge, recorded and put out for people to learn about pediatric medicine and all the aspects of that. Another shameless plug, we still do have our pediatric conference coming up on December 1st at the Hotel Roanoke here in Roanoke, Virginia. This year we're focusing on all children having special needs and how do we meet them. Great lineup of speakers. We've got a massive poster hall we've put together, so going to be a great conference this year. Registration has not opened but should open in September. We'll be announcing the full agenda and stuff very soon, but it's shaping up to be a great conference. We hope you can join us this year. So enough of me talking. Come to the reason why everyone joined us today. We have Erin Casey, who is going to be talking about the Youth Mental Health First Aid Program. She's going to introduce herself and tell us a little bit about herself, her background, and the program she's with before launching into some info about this program. So with that, I'm going to go ahead and turn it over to Erin. Thank you all very much.
Good afternoon. As Alex said, my name is Erin Casey, and I am a community health educator with Carilion Clinic. I focus primarily on mental and behavioral health within the community. My position is housed within Carilion's Department of Community Health and Outreach, which is led by Shirley Holland, the Vice President of Community Health and Outreach and Development, and Erin Bush, who's the Manager of Community Health and Outreach. Our department facilitates the community health assessments in all of our service areas, which drives our community health programs, our partnerships, coalitions, and grant sponsorships. Our efforts are guided by the public health framework of the Robert Wood Johnson Foundation, which has 4 main influencers of health, which is health behaviors, access and quality of clinical care, social and economic factors, and the physical environment. Over the past 2 rounds of our community health assessments, mental health and substance use disorders have risen as top priorities within all of our communities. Some of the relevant mental health and substance use data points from the 2015 Community Health Needs Assessment are 27% of the participants that took the assessment cited that mental health services were the most difficult to access within the community. And of those 27%, the top 3 barriers listed were lack of non-emergency services, fear, stigma, and shame, and long wait times. 35% of the participants that took the needs assessments stated that a physician had told them that they had depression or anxiety. However, only 17.1% of the people that had taken the assessment stated that they had followed up with a mental health or substance use provider within that past year. And then also the average number of not good mental health days for Carilion service area is 7.4 a month. So that's basically a week out of the month of people saying that they have not good mental health days. In addition, and this is not from our community health assessments, but it's some of the research from the mental health first aid that we go over in the mental health first aid program, is that we know that it takes an average of 10 years for the onset of someone's symptoms before they get professional help for their symptoms. So that's a long time for someone to struggle before they're actually, in a doctor's office or seeing someone for professional help. So all of this leads me to tell you a little bit about my role within our department and within Carilion, and the importance of mental health first aid. In my role, I focus on cultivating a culture of mental wellness through our service areas, and this is through community support, education and training, and advocacy and awareness. I grew up here in the Roanoke Valley. I earned my master's in healthcare communication advocacy from James Madison University in 2016, and I'm a person in recovery from mental illness. And because of that, I can tell you how important this is. There are people in my life who were not trained in, as clinicians or as providers who had a major impact in my life as a youth when I was struggling, in my teens and adolescent years. So today I'm going to focus on youth mental health first aid and that program we offer in the community. It's a program that is designed by the National Council for Behavioral Health, and I became an instructor for this program in January of 2017. The program is an 8-hour class, and it is designed for any adult who works with adolescents. However, it can also be catered to be taught to adolescents so that they can be peer mental health first aiders to their peers. So if we do a group at a high school, so that they can navigate their peers to resources, and also to encourage them to reduce using stigmatizing language. So mental health first aid was originally designed as an adult program in 2001 by Betty Kitchener and Anthony Jorm in Australia. Its mission was to create an empowered community providing support to one another in times of mental health problems and mental health crisis. Since then, this program has expanded internationally and undergone randomized trials and research which have demonstrated improved knowledge of mental health and crises, reduction in stigmatizing attitudes towards mental health and substance use, increased action in first aid towards people with mental illness, mental health problems and challenges. It's also expanded into specific subcategories beyond the scope of for just adults. So this includes the youth program that we're talking about today, higher ed, there's a program for higher ed, and then also for public safety. The youth version of mental health first aid utilizes many of the same components of the traditional version aimed at the adult population. The primary differences in the youth version, though, are a highlighted focus on the characteristics of typical adolescence, because we all know that sometimes as people transition into adolescence, there is some of those hormones and things can cause adolescent growth. They could sleep a lot, which can also be an indicator in depression. So we kind of tease out some of those things. There also are legal and ethical implications in working with youth that aren't there with adults, and intervening in youth crises. And then especially depending on the role. So if I'm teaching this course to a group of teachers, they have specific supervisory roles and legal implications, and same with medical professionals. Or if I'm teaching with parents or clergy members, the roles can be different. We also talk about specific life transitions and stressors that happen between the ages of 12 and 25. Overall, the National Council positions all mental health first aid courses as CPR for mental health and substance use crisis. If you think about how many people in this country are trained or encouraged to become trained in CPR and how many people actually use that training, and then if you think about how often you might use this mental health first aid training, it kind of is mind-blowing in a way because 25%, the statistic is, 1 in 4 people will suffer from a mental illness at some point in their lifetime. The koala on the left-hand side, his name is Algie, and he's the mascot for Mental Health First Aid, and his name is actually the acronym for the 5-step action plan that each person in the course is taught to use as a first aider, and we'll discuss that a little bit later as we go through this. So as discussed previously, the youth version of the Mental Health First Aid is designed for any adult who interacts regularly with young people. So for courses, they can be catered to specific populations, teachers or physicians or parents or church members. The activities can be catered that way, but you don't have to have any sort of degree or background in order to take this course. There are no prerequisites at all. It's any adult who works with young people or interacts with them on a daily basis. The course is divided up into 3 sections, and within those 3 sections, the course participants will really accomplish these 5 things that you see here on the screen. In the first section, you really talk about the relevant data. So in the data in this course, you really focus on national data and statistics. You also tease out, adolescence and then common mental health challenges for youth. You talk about the onset, when is the likely onset for depression, when is the likely onset for anxiety, and some of those symptoms that you might see with those things. You also talk about protective factors and risk factors. So if you're working with a youth and you're able to assess, on an individual level, a number of protective factors that a youth might have or a number of risk factors, that's helpful information to know when you're walking through the 5-step Algie plan. And we also talk a lot about resiliency and recovery in the context of this course. The second section of this course really deep dives into a few different specific types of mental health challenges. So we really go into depression, anxiety, eating disorder, psychosis, substance use, and attention deficit disorder and disruptive behavior disorders. The reason they have those is because of, one, either they're common for youth or because of their severity. The potential for them to be life-threatening. And so those sometimes have a little bit of the Algie plan can be catered to those specific illnesses if that's what's happening with the youth. The third section of the mental health first aid course is really talking about crisis. And when we say crisis, obviously a lot of us think about, suicidal thoughts and behaviors. We also think about non-suicidal self-injury, but we also talk about panic attacks, trauma, and then traumatic events. So the difference would be, lifelong trauma that youth is dealing with that could influence their behavior, but then also acute trauma events that might happen in one time, and then acute psychosis, medical emergencies relating to alcohol and substance use, and then aggressive behaviors. So for each of the specific mental health challenges that we go through, we talk about, you know, the definition of the disorder. We want to make sure that everyone in the class has a really good, solid definition. We talk about specific risk factors, and that goes back to, you know, when we talk about the risk factors and the protective factors, we really talk about the importance of early intervention. You know, we talked earlier about how oftentimes there's a 10-year delay in between the onset of symptoms and the time someone gets help. And the purpose behind mental health first aid is to cut that delay, you know, considerably. The chances of recovery for someone, if that is cut, is exponentially increases. And we talk a lot about how mental health first aiders, people who have this training, have an awesome opportunity to intervene in that way. And then we also talk about the specific steps to the 5-step mental health action plan, the ALGE plan, to be used in each of these contexts, because it would look different if you're working with someone who's experiencing psychosis versus someone who's experiencing anxiety, and depending on that level. We also spend a good bit of time in discussion about identifying at what point an individual is in crisis and what the appropriate steps are in those instances, what the most effective communication practices, and the relationship context. You know, the relationship context is something that is extremely important, whether, you know, it's going to be very different if, you know, it's a parent talking to their child about something that they're noticing versus if it's a coach talking to someone on their team. It's also going to be different if it's a teacher talking to a student, or if it's a physician talking to their patient. The relationship is extremely key, not only in the boundaries in which we can talk with the individual about what we're noticing, but it's also the relationship is important in building trust, and eliciting how we talk about it in that relationship is important in eliciting, you know, a positive response rather than a negative reaction. And so we do a lot of practice with those sorts of things. So Youth Mental Health First Aid is a highly interactive course. It includes role-playing, brainstorming, discussion, video testimonials, and real-world scenarios. The reason it's set up this way is because we have to practice some of these communication techniques. We have to think about the real-world situations in which we're going to be seeing the symptoms or the signs that we talk about. And we have to put ourselves in the shoes of, you know, what if I'm in this situation at my job or at home? How am I going to implement some of the techniques that I'm learning in this class? And the best way that the creators of this course have found to do is to actually practice that in class. What's helpful to note is that, you know, when I do teach this course, I cater to my audience, and I think I mentioned that earlier, but I found that that's probably one of the most effective things to do. So if I teach to teachers all of the scenarios and all of the activities, you know, we do, everything revolves around, you know, you're working with a student in your class, or the same with if we're working with a church. You know, this is someone in your youth group or someone in your congregation, and that seems to bring it to real life from people. It's also, everyone seems to respond really positively to the video testimonials from Kevin Hines, which you can see is the last point on this slide. Kevin Hines is a survivor of a suicide attempt. He jumped off the Golden Gate Bridge. He was in his early 20s, and he's in recovery from bipolar disorder, and he talks about what his experience was like in high school and all of the different people that he interacted with, and those who interacted with him in a really positive and helpful way, and those who really didn't, and not in a shameful way, but in a way that is helpful for the class to learn from. Another big thing that we talk about in this class is stigma and how reinforcing our language is. Stigma is, as I said earlier, is one of the biggest barriers to people seeking help in our communities, and it becomes extremely hard for people to get the help that they need. So we actually have a couple of activities that bring awareness to the everyday language that we're using that actually may very unintentionally be reinforcing the stigma that we're trying to prevent in our communities. And finally, and this is not actually finally, but the next slide, this is finally what you'll learn, but upon completing the course, each participant will be certified in mental health first aid for 3 years, and they can renew that certification through the National Council of Behavioral Health. And hopefully with that, you'll have a greater understanding to recognize the signs and symptoms of mental distress and youth. You'll have a greater understanding of the impact of stigma on individuals' ability to seek help, and you'll be familiar with the 5-step action plan. You can see the 5-step action plan at the bottom there of the screen, and you can see it's assess for risk or harm for suicide, and they actually have a caveat to this. It's also the approach, so how we approach the individual is just as important. We give reassurance. We listen non-judgmentally, and we have activities to practice that. We give reassurance and information about, we help to normalize what the individual is experiencing. We let them know that they're not alone. We encourage appropriate professional help, and we encourage self-help and other support strategies. It's important to note that as first aiders, we are not, licensed professional counselors. We are not certified mental health professionals. We are not the, end of the road in seeking help. We are the very first contact point for youth who are beginning their journey to recovery. So, what is the purpose of the course, and what will the participants walk away with? And it really is truly a lot of resources. So as I said, you'll get a 3-year certification in youth mental health first aid, which you can renew online. Each participant walks home with a 213-page manual that covers all the material and more that we use in class, and it's filled with, national resources. I also provide all of the participants in the courses that I teach with local resources. So where are the local community resources that are free and reduced cost? Where are the local youth empowerment resources? Where can youth get hooked into that are some of those protective factors? And, how do you access some of those? And then I also provide everyone with effective self-help strategies and community resources. So those cover the last 2 E's to assist the participants who are trained in the courses that I teach. Those are not required by the mental health first aid, but I have found that they're really useful for the people in the class. Additionally, I also will keep the people that take the class updated with local data from our service area. So the course naturally covers all national data, but I also provide resources for local data as we do the community health needs assessment and conduct that research. I keep the course participants updated on that. So in preparing for this course or this webinar, I went ahead and scheduled 3 youth mental health first aid courses. They're all here in Roanoke, so for some of our listeners that are out of town, they might not be super convenient, but so we have one on September 23rd, August 14th, and October 14th and October 28th. The cost for each is $25, and that covers the cost of the book and any other, all the other activity resources that we use. They're located all of them are located at 1202 3rd Street. We have a classroom downstairs. You can also register for the course. That's kind of a long link there, but you can register by going to CarilionClinic.org, navigating to the top left and clicking the menu button, and then under the Health and Wellness heading, select Calendar, then search Mental Health First Aid, and the 3 courses will appear, and it'll take you to the registration page. You're also welcome to email me at eecasey@CarilionClinic.org, and I will happily send you the link. And thank you so much for tuning in. Don't hesitate to contact me if you have any questions.
All right. Thank you very much, Casey. We've got a couple of minutes left, so I can unmute the phones here really fast for questions. Before that, a question I wanted to ask, we do have a lot of people who listen to these from outside the Carilion system, or really outside the Roanoke Valley area. Do you have resources? Are you capable of going out to communities outside of the Roanoke Valley, and what's your process for that? So if you could just take a minute and speak to that, and then I'll open up the phones.
Yes, so I'm happy to travel to any location and provide the course. We do require that there's at least 10 people in the course that I provide off-site, and then there's a $100 off-site fee because I'm bringing all of the stuff to you, and then you also will pay for my mileage to and from the location, but I will travel anywhere to provide the course. And yeah, so there's no limit to that, and you can email me at eecasey@CarilionClinic.org to schedule that if you wish.
Perfect. Thank you very much. Okay, I'm going to go ahead and unmute the phones here for the last minute. If you do not have a question or you don't want to make a comment, if you would just please put your phone on mute so we don't hear any background noise or background conversations.
The conference is now in talk mode.
Okay, so if anyone on the line has a question or would like to make a comment, now's your chance. Anyone at all? Okay. Going once, going twice? All right, I'm going to continue on here. If you do have a question, just chime in and we can always come back. Reminder, if you want your Category 1 AMA PRA credit, to fill out the survey that is in the email calendar appointment. If you're listening to this live, if you're listening to this as a recording, remember to click on the Show More button under the YouTube description in the video, and you'll see all of the links to all of our CME surveys and information there. Join us every Thursday for Grand Rounds, or usually we do the first Tuesday of the month for our Lunch and Learns, trying to keep a consistent schedule for that. If you have any recommendations that you'd like for us to cover for these bite-sized webinars, let me know. I'm happy to put them on the list. With that, we're going to go ahead and disconnect the phone lines now if there's no additional questions. No? Okay. Thank you all very much for joining us, and we will see you again next month.